A resident seems frustrated and refuses to eat dinner. What is the best approach for a CNA? A. Force the resident to eat. B. Ask the resident if they would like a different option. C. Ignore the behavior. D. Report immediately to a supervisor without interaction. Answer: B. Asking about preferences shows respect, encourages cooperation, and builds trust while addressing the resident's needs. A resident speaks a language the CNA does not understand. What is the most effective communication strategy? A. Speak loud or slowly. B. Use gestures, pictures, or translation services. C. Ignore the resident. D. Ask another resident to interpret. Answer: B. Using nonverbal tools or professional interpreters ensures accurate communication while maintaining dignity and safety. During care, a resident begins to cry. What should the CNA do first? A. Continue with care. B. Ask the resident how they are feeling and listen. C. Leave the room. D. Tell them it's not a big deal. Answer: B. Listening empathetically validates emotions and strengthens interpersonal relationships, improving care outcomes. Which of the following demonstrates active listening? A. Nodding and maintaining eye contact while resident speaks. B. Looking at a phone during conversation. C. Interrupting to give advice immediately. D. Talking over the resident. Answer: A. Active listening involves attention, eye contact, and verbal/nonverbal cues that show understanding and respect. A resident uses offensive language during care. How should the CNA respond? A. React angrily. B. Remain calm, avoid escalating, and address needs professionally. C. Leave immediately. D. Join in with similar language. Answer: B. Maintaining professionalism and calmness de-escalates tension and ensures safe, respectful interactions. Which action helps build trust with residents? A. Following through on promises and commitments. B. Offering personal opinions frequently. C. Ignoring requests. D. Completing care quickly without explanation. Answer: A. Reliability and consistency reassure residents, promoting trust and cooperative care. A resident refuses medication. What is the best initial response by the CNA? A. Force the resident to take it. B. Document refusal and report to the nurse. C. Ignore and continue with other tasks. D. Punish the resident. Answer: B. Respecting autonomy while reporting ensures safety and allows licensed staff to follow up appropriately. Which nonverbal behavior can convey empathy to a resident? A. Crossing arms. B. Sitting at eye level and leaning slightly forward. C. Tapping foot impatiently. D. Avoiding eye contact. Answer: B. Sitting at eye level, open posture, and forward lean demonstrate attentiveness and empathy. A resident becomes agitated during bathing. What is the best communication strategy? A. Yell to gain attention. B. Speak slowly, calmly, and explain each step. C. Ignore agitation and finish quickly. D. Leave immediately. Answer: B. Calm, clear, step-by-step instructions help reduce anxiety and improve cooperation. A CNA is assigned to a new resident. Which approach fosters a positive first impression? A. Introduce self and explain care plan clearly. B. Begin care without speaking. C. Wait for resident to approach first. D. Use medical jargon. Answer: A. Introductions and clear explanations establish rapport and trust, reducing resident anxiety. How should a CNA respond when a resident asks a personal question about the CNA's life? A. Share personal details freely. B. Politely redirect conversation to focus on residents' needs. C. Refuse to speak. D. Ignore the question. Answer: B. Professional boundaries are maintained by redirecting while remaining friendly and empathetic. Which communication technique helps clarify instructions for a resident with cognitive impairment? A. Use short, simple sentences and repeat if necessary. B. Speak quickly. C. Use complex medical terms. D. Ignore their confusion. Answer: A. Simplified, clear instructions reduce confusion and support resident understanding and cooperation. A resident expresses fear about a procedure. How should the CNA respond? A. Dismiss their feelings. B. Listen, acknowledge fear, and explain what will happen. C. Avoid answering. D. Rush the procedure. Answer: B. Acknowledging and explaining fears helps residents feel safe, respected, and more cooperative. During care, two residents start arguing. What is the CNA's best first response? A. Join the argument. B. Calmly separate residents and address each individually. C. Leave them alone. D. Yell to stop them. Answer: B. Safety and de-escalation are prioritized while maintaining respect and professionalism. Which statement reflects effective written communication in a CNA's charting? A. Patient fine. B. Patient refused lunch at 12:15, offered alternate meal at 12:45, remained calm. C. Resident not acting right. D. Did some care. Answer: B. Specific, objective documentation communicates accurate information for care continuity and safety. Which action demonstrates cultural competence in communication? A. Ignoring dietary or religious preferences. B. Asking and respecting cultural needs and adapting care. C. Assuming all residents prefer same foods. D. Using only English, regardless of residents' preference. Answer: B. Cultural competence involves acknowledging, respecting, and adapting to diverse resident needs. A resident speaks softly and CNA cannot hear. What should the CNA do? A. Speak louder over them. B. Ask politely for repetition and maintain eye contact. C. Ignore and continue. D. Assume what was said. Answer: B. Clarifying respectfully avoids miscommunication while showing attentiveness. A CNA receives constructive feedback from a nurse. What is the appropriate response? A. Get defensive. B. Listen carefully, ask clarifying questions, and apply suggestions. C. Ignore feedback. D. Complain to coworkers. Answer: B. Open, professional response improves skills, promotes teamwork, and enhances resident care. Which phrase demonstrates therapeutic communication? A. You shouldn't feel that way. B. I understand you're upset. Let's see how I can help. C. Just calm down. D. This isn't important. Answer: B. Therapeutic communication validates feelings and supports problem solving in a respectful manner. When a resident expresses sadness, which is the least appropriate response? A. I'm here to listen if you want to talk. B. It's silly to be sad. C. Maintain eye contact and offer comfort. D. Acknowledge their emotions. Answer: B. Minimizing emotions is disrespectful and can harm trust. Empathy and active listening are essential. A resident repeatedly interrupts during care. How should the CNA respond? A. Interrupt back. B. Gently acknowledge and redirect attention to care task. C. Ignore entirely. D. Yell to stop. Answer: B. Respectful redirection maintains rapport and ensures care is completed safely. Which is an example of professional boundary violation? A. Accepting a resident's request for assistance with care. B. Sharing personal social media information with resident. C. Explaining a procedure before starting. D. Reporting unsafe conditions. Answer: B. Professional boundaries protect both the CNA and resident, maintaining ethical and safe interactions. A resident asks repetitive questions due to memory issues. How should the CNA respond? A. Respond patiently each time with the same answer. B. Get frustrated. C. Ignore questions. D. Tell them to stop. Answer A. Consistent, patient responses reduce anxiety, maintain dignity, and promote trust. Which communication technique is most effective when giving instructions to a resident with hearing impairment? A. Speak at normal speed. B. Face the resident, use clear speech and gestures. C. Shout across the room. D. Write nothing down. Answer B. Combining visual cues with clear verbal communication enhances understanding for residents with hearing loss. During handoff, which information is most important to communicate? A. Residents' favorite TV shows. B. Residents' current condition, medications, and special needs. C. Gossip about staff. D. Previous CNAs' personal opinions. Answer B. Handoffs focus on relevant clinical information to ensure continuity, safety, and high-quality resident care.